Hi, everyone. I hope you were here for Opioid Settlements 101. I'm Kristen Pendergrass. I'm the Vice President of State Policy at Shatterproof. Thank you. Do you want me to do the slides? I can do the slides. So Shatterproof is a national nonprofit. We've been around for about 12 years. We were founded after our founder lost his son as a result of his opioid addiction. So we created an organization that would provide the kinds of services and supports that would have been helpful for his family. So we do a lot of work around stigma. We have a quality treatment locator in 14 states, unfortunately not Colorado. And then on the policy side, which is what I do, a lot of my work is around opioid settlement funds. So I go around the country and talk about what's happening, try and help jurisdictions address some of the challenges they're facing, and then I lead a national coalition. We're informal, of about 40 different national organizations that are working on settlement funds, and I always call it the good governance side of settlement funds. So how do we make sure that there's transparency and accountability and that funding is spent on evidence-based interventions? So I'm gonna run through really high level what's happening at the national level. If you have known about settlement funds, some of this will be repeat, but I will talk a little bit about some of the kind of changes that are coming down the pike, some of the things that we're seeing on the horizon that we're expecting to come, but also give you some of the history and stuff. And then I'm okay if you want to interrupt with questions, like if something's not clear or you want more information from the national perspective, happy to provide that, just call out. We have a mic runner. And then Jack and maybe Jamie are gonna give the Colorado specific. So I'll touch a little bit on Colorado where I know things just from having been in touch with your leadership here, but mostly I'm gonna focus on the national level. So let me see if I can, there we go. Let's do the history. So we know that states, counties, local governments, and tribal governments sued companies up and down the supply chain of opioids, the companies that had a hand in creating the opioid crisis. Purdue, of course, is the most famous, but there are a lot of different manufacturers, pharmacies, distributors that played a role in creating this crisis and exacerbating it. Ultimately, almost all of the cases have been adjudicated. There's still Purdue, which is not final, but before Purdue, it's about $56 billion going out to state, local, and tribal governments over 18 years. So it's a lot of money, but it's not enough money. This is the timeline, big picture for what has happened, what led up to where we are right now. Most important ones are the beginning, 2007, when Kentucky was the first state to sue Purdue for their role in creating the opioid crisis. 2021, up at the top, McKinsey was the first company to do a multi-state settlement. It was pretty small, they're a consulting firm, but it was a couple $100 million to, I think, 47 states. The other big one was 2022 and then up there 2023 when the big three distributors and Johnson & Johnson, which is actually Janssen, finalized their settlement, $26 billion out to states. And that's kind of the one that everyone uses as an anchor when they talk about Exhibit E or all these terms that you're gonna have. They all originated with that $26 billion settlement. And then, as you know, more and more companies have been sued. Like I said, we're waiting on Purdue to be finalized, but it sounds like we're getting close. And when that is over, that will be kind of we'll kind of know what the landscape is gonna look like. Leading up to now, a lot of what's happened in the opioid settlement space is because of what happened in the tobacco settlements. So tobacco settlements happened in the 90s. All the states sued the tobacco companies for their role in lung cancer rates, in health effects from tobacco, and that has been over $200 billion to states. To date, states are still receiving tobacco settlement funds, but the way that mostly influenced opioid settlement funds is that so little of it was spent on what it was intended for. So the tobacco settlement money was supposed to go towards prevention, cessation of tobacco use, and associated health costs that states had incurred. Tobacco Free Kids does an annual survey every year, and they release results for each state, but also on a national level, and they've shown that it's something like 10% of the money, maybe even less, actually goes towards its intended purpose. So when the opioid settlements were getting finalized, a lot of people were worried that that same thing was going to happen with opioids while we have a crisis going on and people dying. So 2021, 2022, 2023, we're in the height of COVID, we're in the height of fentanyl, and people are dying at astronomical rates. And so there was a very real fear that that money would be squandered, mismanaged, used to fill holes in government budgets. You may, hopefully, well, this is a 101, so I'll just do it. There's kind of 4 waves of the opioid crisis. The first was created by these pharma companies, right? Prescription opioids that were overprescribed. The real risks of addiction were downplayed or ignored. So that was the first. Then states, mostly states, started reducing their prescribing, but people were already dependent, and so a market came up with heroin. And so people who could no longer access their pharmaceuticals through their doctor went to street heroin. Then, I'm really oversimplifying this, but this is the basics of the 3 waves. Heroin comes from a poppy plant. Fentanyl, you can create in a lab. So it's easier to create, it's not subject to drought or anything else, and it's more potent, and so it's easier to traffic, right? A brick of fentanyl can get in a million different ways into the United States, and then you cut it up, but it is more potent, and so it's also a lot more deadly. So that fentanyl is the 3rd wave of the opioid crisis, which then shortly after that, COVID comes and exacerbates it all. And then the 4th wave of the opioid crisis is what we're in right now, which is polysubstance use, and fentanyl is in everything. And when I say fentanyl, it's really synthetic opioids. It feels like every 3 months, 6 months, there's a new substance that's entered the drug supply, and we're trying to figure out what are the implications of this, how is it going to affect people, et cetera, et cetera. And then at the bottom, I just have abatement, which is the point of all of this. This money coming in from the opioid settlement funds is meant to abate the harms that were created by these companies. So I said a lot of people were worried that the money that was coming in from opioid settlements was gonna go the way of tobacco settlements and not be used to address this awful crisis that we're facing. So a number of states were aware of this and thinking about it, but also a number of advocates were thinking about this. So at the time, I was with the Pew Charitable Trust, and we were talking about how can we give out guidance, how can we talk to states, what can we do? But the real leader in this space has been Johns Hopkins University. They created the principles for the use of funds from the opioid litigation. I hope this isn't brand new for anyone. I'm gonna run through the principles, but pretty quickly. So if you want more information, their website is great. Over 60 national organizations have endorsed the principles. Shatterproof was one of the early endorsers, and I worked with my counterpart at Johns Hopkins to go and promote the principles around the country. They have been adopted by, we've lost count of how many state and local governments. Colorado has a version that they have adapted to their needs that Jack's gonna show you towards the end. So like I said, I'm gonna run through these. I guess one more thing to say, I think I mentioned this, that I convene a coalition of national organizations. So these are just some of the organizations that are part of the coalition. Most of them have endorsed the principles. There's some overlap, but the kind of organizations that are concerned about people with substance use disorder, people in recovery, and making sure that these funds get used to their highest, best use. So these are the principles. Like I said, I'm gonna run through each of them, but pretty quickly, and just talk a little bit about kind of where the focus is on each of them. Because sometimes it's like, use the funds to spend lives. Well, yeah, but what does that mean? So for principle 1, spend money to save lives. At the outset, we were really focused on the top one, establish a dedicated fund. Make sure that that money is set apart so that it doesn't just go into the general fund and get absorbed into budgets and go to fill potholes or whatever else. That has kind of happened for the most part. And so what we're really focusing on right now are the bottom ones. So with the situation that is coming down from the federal government, there's a lot of concerns about supplantation, which Colorado has adopted a definition of supplantation and some guidance for the regions and, well, the state, the regions, and local governments about supplantation. So Jack will talk about that. But these funds are supposed to be additive, right? They're supposed to add on to whatever the state or local government is already doing, as opposed to filling holes and displacing funds for something else. Also spending money over time, we've got 18 years. A lot of that money was front-loaded. So over time, go your way, the funds will go down. And whatever we're funding now, we can't keep funding because the money will reduce. So thinking about how can we invest in infrastructure, which Colorado does well, how can we meet needs now, but also not create brand new programs that we're not gonna be able to fund in 10 years because the funding will reduce. And then public reporting, which I'll talk a little bit more about later. Colorado is also doing wonderful on the public reporting and just the transparency. I will say, transparency is a word that we all know what it means, but it doesn't feel very personal. At Shatterproof, we get a lot of calls from people who have lost someone, and they want to know where the money's going because they lost a loved one to this crisis, and it's important to them that the funds get used to keep anyone else from dying. So this is a reporter that I work very closely with at KFF Health News, and I'll talk a little bit more about our collaborations in a bit. But this is one of the reports she's done on supplantation and how state budgets are going down, and so people see the opioid settlement funds as an opportunity, right? There's not as many guardrails on settlement funds as there are on a federal grant. And so in every state, it's a little bit different. Colorado, you guys are safe for the most part. But in a lot of other states, we see governors using opioid settlement funds to balance their budgets. We see legislators trying to sweep the funds to fund a pet project. So it is a very real thing that is happening around the country. Principle number 2, use evidence to guide spending. We all understand this. It's evidence-based, it's effective. We know those words get thrown around a lot. But the other thing that people forget about this is also to build new evidence, right? This is a great opportunity. I know Oregon is doing a great job and Colorado has had an innovation grant. Let's try new things. Let's see what works, but you can't do that unless you're also evaluating it. So that gets into data and all of the fun metrics conversations. It sounds like the session before me was about data and metrics. So that is really important as we build our evidence base to learn what works. And this is actually something that I helped create with the Colorado Governor's Budget Office 10 years ago, but this is kind of the steps to building evidence. Thinking about, okay, we've got an idea, how can we get it from an idea all the way up to, we know that this intervention fixes this or addresses this. Yeah, I have to, yeah.
Check. So I think one of the things that we've been really concerned about is finding balance in an evidence-informed approach, specifically because we know a lot of programs are innovating and there isn't a historic data line, and sometimes measuring for easy to harness data doesn't always put the best program forward. So in what ways would you see or have you seen states balance between qualitative, quantitative data, innovative practice, and evidence-based implementation?
Yes, everyone is dealing with this. There is no easy answer. I think part of it is in the design of the RFPs, right? What are you actually measuring and why? Don't just measure things to measure them, but how is the data that you're collecting from your grantee going to show that that program was effective? And I mean, it gets really complicated. This used to be my entire job. There's, people with PhDs working on this all over the country. Thinking about how can we show an impact and show effectiveness without doing a randomized control trial, which takes years and tons of money. The other thing that I have not seen happen yet, but I am still hopeful, is partnering with a local university. There's a lot of grad students out there who need projects, research projects. Colorado has a history of that at Denver University of Denver. There is a policy lab, which the name just flew out of my brain. The Action Lab, thank you. They're doing great work partnering with the state to say, okay, what questions do you have, and then how can we show the evidence or see if that works, testing interventions, that kind of stuff. Everyone's dealing with this. There's no great answer. Some of the national organizations have put out guidance. Johns Hopkins University has a tool they call OSPRI, which is a way to look at metrics that you could ask of your grantees and identify those metrics. Ideally, we'd have outcome data, but that's kind of hard sometimes, especially with like a prevention program. So sometimes you're looking at how many people did you serve? And that's not perfect, but it's something. So anyway, an imperfect answer, but we're all grappling with it together. Okay, principle number 3, invest in youth prevention. I would say this is the one that everyone is on board with, everyone understands, everyone is committed to it, and very few people are doing it well. I'll talk a little bit later about a project that I've done tracking settlement funds around the country and how they're actually being spent. And I think, unfortunately, a lot of the money that's being spent on youth prevention is being wasted because it is not being spent on evidence-based interventions that we know have an impact. It's being spent on, and I apologize if I offend you, but it's being spent on bringing in a local acting troupe to talk to the kids about drugs. And like, one-time spending, that's not an evidence-based effective youth prevention intervention. There is a resource which I did not link because it was not out when my slides were done, but the Partnership to End Addiction has recently put out a new report. It's guidance on spending opioid settlement funds on evidence-based prevention programs, and it's really great. First, it talks about what is evidence-based prevention, and then it talks about looking at prevention through the eyes or through the lens of settlement funds. So highly recommend that you Google that and find that. I've been sending it around to a bunch of people. All right, another thing about prevention, there's primary prevention, which is usually what we're talking about, right? Youth prevention. But there's also secondary prevention. I was just having a conversation with someone 15 minutes ago about secondary prevention, which is like early intervention, so screening and early intervention, right? If we can find someone when they're just starting to struggle and get them the services that they need before they end up with a full-blown substance use disorder, that is secondary prevention. And then tertiary prevention is also called harm reduction, and that is just reducing the harms to someone. HIV testing, clean needles, all of these things that are harm reduction, they are ultimately keeping someone alive and reducing the harms to them. It's also called risk reduction. And then this is the other thing about prevention, is it really is part of the continuum of care. So thinking about we prevent, and then we treat, and then when someone is in recovery. All right, principle number 4, focusing on racial equity. Colorado has also taken action here. Oh, we have a question, I'm sorry.
Hey, sorry, I just had a quick question about principle number 3. You mentioned there was a report that was put out on like evidence-based models. I didn't get a chance to write that down.
No.
Could you remind me what it was?
This
And then
is great.
off the top of your head, if you know of any evidence-based youth programs or what a strong few examples of evidence-based youth prevention programs, I'd love to just hear some examples.
Yeah. So the report is put out by Partnership to End Addiction. And if you just Google Partnership to End Addiction, opioid settlement prevention, I'm sure it will come up. Okay. There is a great resource in Colorado. Unfortunately, I don't know, Jose, you might know the status of it right now, but it lost its funding. It was at CU Boulder, Blueprints, yes. They have a clearinghouse of all the prevention programs, or all the ones that they've evaluated, and they show which ones are most evidence-based and effective. So Blueprints for Healthy Youth Prevention or something like that. And
awesome. Thank you so much.
Yeah.
Let me add one thing that you could also look into, and I would highly recommend. But anything that, and the people that do this the best, believe it or not, is 4-H and the extension offices, positive youth development. Anything you can do that incorporates the principles of positive development in your prevention programming, that is evidence-based work. And CSU up north in terms of extension office is doing some really good work in this area, and across the nation. they've got some really good frameworks for that. So anything that really focuses on how you keep young people safe, educated, get them a trusted adult, positive youth development, you can't go wrong with that. That's some of the top evidence-based prevention work. And I would love to see more opioid settlement funds funding things like CSU Extension. So if you all are in those groups, think about that, all right? Especially because out in the frontier rural areas.
Liz Smith, Gunnison County Commissioner, and I know that AG Weiser has been saying a lot about mentorship programs, and I just wanted to say Gunnison Valley Mentorships has been funded by our Opioid Regional Council, and they have a lot of data-driven metrics that demonstrate the impact of that, and I'd be happy to share that resource with anyone. Thanks.
Awesome. This is great. All right, I'm going to keep going. Focus on racial equity. Like I said, Colorado has some guidance here. There have been some changes at the federal level, which have caused some divestment in equity programs. Opioid settlement funds are not tax dollars. They are not subject to federal whims, and so they can and should be used to fund equity initiatives. And you know, we're all grappling with the wording that we use right now, but people of color, specifically older Black males, at least where I live in Washington, D.C., and tribal communities are the hardest hit. They have the highest rates of overdose, and so focusing our attention towards their communities is really important right now. You know, we've seen a reduction in overdose deaths around the country, but not in those communities. And so Principle 4 is very, very important. These are just some of the things to think about when you're looking at disproportionately impacted groups or targeting racial equity. So making sure, and Colorado does such a good job of this, but making sure that people with lived experience are represented on advisory boards and councils, and as Raquel always says, that they actually have power to vote, not just being there as a token. Criminal justice interventions, we know that when people are released from incarceration, they are at their most vulnerable for overdose, but also at the front end, looking at diversion deflection programs, and then approved uses, Exhibit E, which I hope you all are familiar with, but it was the list of core strategies and approved uses that was released with that big $26 billion that I mentioned at the outset. And there are a number of approved uses that target equity. All right, principle number 5. This is the one we probably spend the most time on, to be honest. Develop a fair and transparent process. States are really trying on this, and to varying degrees of success. I'm gonna skip over the details here and show this, which is kind of how we've been thinking about the different steps of developing a fair and transparent process, starting off with a needs assessment. And this is actually the place where I've been spending a lot of time recently. You'd think 3 or 4 years in that people would have moved on, but they're not. So having a needs assessment to inform what are the strengths that we could build on, what are the gaps that need to be filled, and just knowing more about your community. And I'll show you a resource in a second, but there are ways to do this that are not $5 million to a consulting firm, right? There are ways to do it in-house, using available data, et cetera. Next is having diverse input. We've talked about that a little bit. You guys are doing a great job on that, but it's all kinds of diversity that we should be thinking about and making sure we have voices at the table and with the power to vote and speak their minds. Strategic prioritization is the gobbledygook that I use to say, think about using the funds over time, right? We've got 18 years, but also there's a lot of funding streams for substance use disorder. There's federal grants, there's state grants, pulling down Medicaid dollars. There's no reason why settlement funds should go for something that Medicaid can pay for, right? Thinking about all the different funding streams. This is really complicated and takes a lot of coordination with the state, with the county, to figure out where settlement funds can have the biggest impact. Transparent reporting. What does the public want to know? What do they need to know? I know you guys have your own reporting structures from the regions and the local governments to the state, but then also thinking about reporting that out to the public, and then tracking outcomes, which is ideal, but sometimes we're just tracking how many people we impacted, tracking things that actually matter and that are going to show us the impact that these dollars are having. So needs assessment, the $5 million to a consultant, that was these guys. I just talked to another state that did $1.4 million to a local university and got about a 600-page document out of it. But there are ways over here. This resource, the quick guide that NACO and Johns Hopkins put together, shows how you can leverage local data, local resources to do this much more efficiently. And there are some conversations going on about how local governments can do a needs assessments that will ultimately come up to the state for a statewide view. So something will hopefully be coming on that soon. Diverse input, I mentioned different kinds of diversity, so thinking about demographic diversity, but also urban, rural, frontier communities, different professions being represented at the table, people with lived experience, peers, people who are doctors, people who are nurses, people who are social workers, et cetera, et cetera. So just thinking about who's in the room and who's making decisions and making sure that there's diversity in that. And then strategic prioritization, there's a lot of resources on this, but ultimately I think you need a PhD to really understand it well. But as long as people are thinking about like the Medicaid thing, don't spend opioid settlement dollars on something that Medicaid can pay for, and thinking about the different lines of funding that are coming in and how to maximize settlement funds, because they don't have a lot of guardrails on them. And that can be both a curse and an opportunity. Transparent reporting on the left, this is Arkansas, which is doing an amazing job of reporting their local funds. They pooled the 2/3 of funds that went to their local governments and are spending them together in a kind of a pooled, but they're also trying to make sure that they reach everyone. And then over on the right, I'm pretty sure this is Minnesota, which has a really interesting, they have an opioid tax and settlement funds that they pool and then get out into communities. So they have a pretty good reporting structure there. And then tracking outcomes, one more thing I'll say about this, not to beat a dead horse, but we always talk about overdose deaths, and a lot of that, not a lot, some of that is out of our control, right? What's happening with the cartels and with the formulations and the drugs that are coming in off the street, it's not necessarily in our control. So we want to track other things to track our progress. How many people are dying is not enough, right? Because we don't necessarily have an impact on that. Hopefully we do, but there are other things that we should be tracking. How many non-fatal overdoses are we having? How many people are getting access to evidence-based treatment, whether that's methadone or buprenorphine or medications for alcohol use disorder? Anyway, there's a lot of other things that could be tracked to show the impact that settlement funds are having and the impact that all of our efforts at the state and local level are having on the crisis. All right, I'm gonna go even faster. A reminder of the coalition. Jamie and Jack know this, but if you guys ever have questions, funnel them through them or my emails at the end. Our coalition exists to provide you guys with the resources that you need to do your jobs and to do them well. So we're always happy to take requests or to field questions from people. This is the tracking project I mentioned that I did with KFF Health News and Johns Hopkins University. As we were going around talking about the principles, the one question I got everywhere was, who is tracking how the funds are spent? And the answer is no one, because it's hard. So we decided, the three organizations decided to do it. We found, I hope, every report that was issued by a state or from a local government to a state, every expenditure report, and we put it in this mammoth database. So it's, who was the recipient, where did the funds come from, how much money was it, obviously, and then we categorized it by the 4 buckets of, I have not found a better word for buckets, but prevention, treatment, harm reduction, and recovery. And then we also categorized it by the 9 core strategies that are laid out in Exhibit E. So this is from the end of 2024 is when this data came out, and it captured all publicly available expenditures for calendar years 2022 and 2023. The thing on the left shows funds that had been expended and not expended. So all of the blue or green, whatever color that is, those are funds that have gone out the door. All of the yellow was funds that had not yet been spent, and all of the gray is unknown. We have no idea where those funds are. We know that they were supposed to be received by states, but we have no idea if they had been spent or not. On the right, this crazy graphic. It actually does have all 50 states, but there's just too much information. If you hover over a state, it'll show you how much of the state's total is going towards each of those. So in the first week of November, we have our next iteration coming out that will cover calendar year 2024. So KFF Health News will publish the report with similar information, although not the exact same. This is the other thing we did based on the 9 core strategies in Exhibit E. The one on the right is actually Colorado, and the one on the left is nationwide. So you can get an idea of where funds are going. I'm gonna keep moving, but I'm happy to answer questions about that at the end. Okay, what's next? What are we talking about? What's in kind of the zeitgeist now around the country? I already talked about supplanting. The other thing we're talking about is sustainability, right? If the funding is going down, how can we make sure that programs that are maybe started or seeded can keep going? There are conversations about partnering with like private philanthropy. How can private philanthropy make the opioid settlement funds go even further? So anyway, those are some of the things that we're talking about with states. Of course, targeting funds to most impacted communities. How can we make sure that the overdose rates for everyone are going down? Reporting and transparency. Last time, we had 1/3 of the funds that were unaccounted for. This time it is less, and states are making some efforts to have more transparency, but there's still a lot that needs to be done. And then data and measuring impact, which is a constant conversation about how best to do that. And then some resources. I imagine these slides are going to be made public, yes? The recordings will be made available. I'm happy to send you the slides. All of these are hyperlinked. This is the Johns Hopkins website. They have the most comprehensive place where you can find resources. But these are some of the other organizations that are doing a really great job of creating resources for state and local governments that are working on settlement funds. And that's my email at the bottom if you have any questions, or like I said, I'm happy to send slides or resources around. And now I'm going to pass it over to Jack to talk about Colorado.
Yes, please give Kristen a round of applause. So, as Kristen said, I'm just going to go a little bit into Colorado's specifics on the opioid settlement. So, as Kristen mentioned, these national settlements are coming from settlements between up to 50 states, and sometimes some of the territories participating as well. But then after each state kind of had to negotiate with its own local governments to figure out what was the distribution model for how those funds would be managed at each state level. Basically, the states needed the local governments to participate in the national settlements to maximize the funds received, so you wouldn't have the states and the local governments suing separately. So there was a need to bring the states and the local governments together. So how did we bring the states and the local governments together? Well, there's an agreement known as the Colorado Opioid Settlement Memorandum of Understanding, which was negotiated between the Colorado Attorney General's office and 312 participating local governments across the state of Colorado. And so this includes all 64 counties and 248 municipalities, ranging from your largest, such as Denver and Colorado Springs, down to your smallest little small towns in rural parts of the state. And so basically this agreement had to set forth how would the funds be managed. The national settlement set forth some general requirements that, generally speaking, most of the settlements require that up to 85% of funds be used for approved purposes. Colorado actually took a step further, and so first of all, it set out its own distribution structure. So you see there are 4 separate shares in Colorado's distribution model. So in a lot of states, funds were split just between the state and the local government. So 50% goes to the state, sometimes going through the legislature through traditional budgetary means, and then the rest going to local governments. Colorado has a very different model. In Colorado, only 10% of funds is received at the state level, which is received by the Attorney General's office. 10% is set aside for a statewide infrastructure share, and so from those 2 shares are those 2 current $23 million funding opportunities. But as you see, the bulk of our funds are split between the regional government share and the local government share. So most of our money, 80% of the funds, are being managed at the local level. And so I'll touch briefly on the local government share first, which is that all 312 local governments in Colorado were entitled to their own allocation from this share, so they each were able to receive a direct allocation. However, to maximize the funds received to reduce administrative costs, local governments had the ability to pool their funds with their regions. And so in reality, actually about a little bit over 70% of funds is being managed at the regional level. So you'll see on this map, this is Colorado's 19 regional maps. And so you can see them at minimum at a single county area. I think our largest is 10 counties. But these were self-formed in the process of the negotiations because we wanted to say, how can local governments best work together to utilize these funds to serve their communities? And so local governments banded together and they self-formed these regions utilizing existing partnerships, existing networks, to utilize existing infrastructure to allow these councils to maximize the funds received. So each one of these regions had to set up their own regional opioid abatement council to manage their share of their funds. One of the things I mentioned is that the national settlements require that usually about 85% of funds be used for approved purposes. Colorado's state agreement actually goes further. We wanted to set a national model that every single dollar should be used for approved purposes. And so it is part of our state agreement that 100% of funds be used for forward-looking approved purposes. This does include administrative costs capped at 10%. And so every local government and region and state agency, when they spend these funds, they have to go into that list of approved purposes in Exhibit E and explicitly call out this is where this is an allowable use of funds. Supplantation, as Kristen mentioned, is a big issue as we look at there's a lot of pressure on local governments, especially as we're seeing changing financial situations at the federal level, at the state level, and even at the local level. But the Colorado Opioid Abatement Council looked at this issue earlier this year, and they said, they looked at the MOU, they looked at the national settlements, and they said supplantation is not an approved use for these funds. These funds are not to be used to supplant existing funds. They are meant to supplement and to expand and sometimes maintain programs when previous funding streams are no longer available. This opportunity with these funds is immense, but only if we respect the intent of these funds, and supplantation is one of those key elements. Another kind of key part is interest. We know as Kristen mentioned, a lot of states and local governments are still sitting on this money and have not kind of figured out the best way to use these funds. Oftentimes, these funds are sitting in interest-bearing accounts, and so Colorado actually determined that the interest earned on any of these opioid settlement funds is also considered opioid settlement funds, and so there's no incentive for local governments to sit on these funds, to use those funds for free purposes. Any interest earned must also be used for that approved purposes and reported on accordingly. So as mentioned, the Johns Hopkins principles at the national level are a fantastic resource for any decision makers looking to kind of figure out what's the best way to kind of utilize these funds. And the Colorado Opioid Abatement Council, which is the oversight entity here in Colorado, looked at those principles and reviewed them and adapted them slightly to meet Colorado's needs. So you'll see on this page, you'll see save the money to save lives, use evidence for overdose prevention and improved health outcomes, invest in cost-effective interventions along the substance use continuum, focus on equity, and develop a fair and transparent process for spending funding. So very similar to those recommendations at the national level. I do just want to pause briefly on that focus on equity. As mentioned, we are seeing kind of changing dynamics at the national level as it relates to funding around equity. The Colorado Opioid Abatement Council specifically reviewed this earlier this year in this context and reaffirmed its commitment to equity. And so we want to kind of really prioritize that these funds are intended to meet those needs of underserved populations and to include those voices of affected individuals in this decision-making process. So that was our very quick kind of overview of the opioid settlements in Colorado. So as mentioned, they are kind of part of this national network, but Colorado has a very different model that is really prioritizing local control. That puts the onus on local governments and their community providers to best utilize these funds to serve their communities. But we truly believe that this model is the best way to serve our communities and get these funds without them being held up at the state level as we've seen at the national level. So I'll pause and see if there's any questions and recommend checking out these two different links. One is the Colorado Opioid Abatement Council's website, and so the Colorado Opioid Abatement Council is the primary oversight entity of funds here in Colorado, and then you can check out our newsletter where we regularly update on statewide activities as well as statewide funding opportunities. So thank you, and I'll turn it to questions. See Liz over there.
Thank you both so much. I wanted to talk a little bit about the conversation on supplanting resources. Just being on one of the opioid councils, I think it can be taken for granted that can be much more complicated than it might sound. And so our community in Gunnison, we were lucky to receive both an RCORE implementation grant of $1 million and also a Bureau of Justice Assistance opioid implementation grant for $1 million. That funding is supposed to go through 2026, but given some of the federal changes that you've mentioned, Jack, I don't know that we will see all of that. And so I think that as somebody, again, on one of the councils, we look at the different applications. Sometimes you see FTE that are coming in to fill behavioral health advocacy spots that are crucial to communities, but not necessarily opioid specific, but relevant. And in other cases, like in our community, we might have programs that we have propped up with federal funding that we know work and have evidence-based outcomes, but the funding is drying up and disappearing. And so I just wondered if maybe you all could expand a little bit more on what, as council members, we should be thinking about when it comes to that balance of both, evidence-based efficacy and the programs that are having money that is going away, and this tension to try and expand the offerings that we have for our communities and not just move resources around.
Absolutely. Thanks so much, Liz. So I think one of the really key pieces that the council, when it was reviewing this matter of supplantation, was looking at, I think the initial language was purely just around funds should be used to supplant and expand existing programs and services. But we actually looked at that. We looked at the kind of the range of funding at this moment, and we realized that wasn't actually enough. And we adjusted the language to also include language to say that funds can also be used to maintain programs when those funds are no longer available, right? And so when these funds, whether it be a federal funding stream, a local funding stream, a state funding stream, et cetera, when those funding streams are no longer available, the COAC would not consider it supplantation to provide funds to maintain a previously existing program if a pre-existing funding source was to go away. We know that there are many successful programs across the state which are facing jeopardy, that are seeing their funding jeopardized. We don't want to see regions and local governments just chasing what is new because they think they can't fund what is already working in their communities. We know some of these programs are critical for their communities, and if regions have the ability to use these funds to maintain these programs, that's absolutely within the allowable use of funds. That would not be considered supplantation. Anything else you would add on that, Kristen?
I'm not going to speak to Colorado specific, but at the national level, these are conversations that we're having. Even within that coalition that I mentioned, there's very different views about what is okay and what is not. So totally understand the this doesn't feel right, but it's a great program and it's working. And so you have a lot of people who are grappling with this around the country.
Yeah, so I think it's in every region's responsibility, look at their allocation of funds, look at the programs that are serving their communities, and look at and obviously evaluate the full array of funding streams that are available, and to make sure we're not missing out on those opportunities to use non-opioid settlement funds such as Medicaid or whatever it may be. But I think I look at these opioid settlement funds, and one of the best opportunities is for us to fill those gaps that are emerging, whether they are pre-existing or they are emerging because of changes in the future funding landscape. Other questions? Thanks so much, Liz. I know we're running up right on time, so I think we've got time for one more question if there's any. Well, seeing none, I just want to say thank you everyone so much for joining us today, and a big shout out to Kristen for making it all the way from DC, though I know you're coming a little bit from around the country on your way here. So you guys all have about 50 minutes to the next session. I hope join us in this session. Next room will be Regional Operations Roundtable, which I'll be facilitating, which will in many ways kind of continue this conversation to look at how are the regional opioid abatement councils in Colorado operating? What are their emerging issues? So hope to see you all soon. Thank you so much for joining us.